Welcome back, everyone, for another deep dive into the world of microbes.
Yeah.
Today, we are focusing on a topic that's particularly relevant for our medical microbiologist listeners out there.
Absolutely.
We're going to be talking about sinusitis and a specific fungus called Aspergillus flavus.
Sounds fun.
Now, to guide us through this fascinating world, we have three awesome sources: Microbiology, the CDC, and the always visually stunning Microbe Canvas.
Excellent resources.
Now, before we jump into the nitty-gritty of it all, I think it's important to quickly touch on how we actually diagnose something like sinusitis in the clinical setting.
Oh, for sure.
We often hear about this thing called an excisional biopsy.
Yeah.
What exactly does that entail?
So an excisional biopsy is basically where you surgically remove the entire suspicious area of tissue.
Ah,
So instead of just taking a little sample like in other types of biopsies, you take the whole thing out.
gotcha.
And this is super important because it lets pathologists really examine the tissue thoroughly under a microscope.
Right.
And that helps them make a more accurate diagnosis,
See, so it's not just about identifying what's there, but also seeing how it's all connected within that tissue.
Exactly.
Now, speaking of sinusitis, for those who might not be familiar,
Right.
what exactly is sinusitis?
Sinusitis is basically an inflammation of the sinuses, those air-filled spaces we have in our skull.
Right.
And it can cause a whole range of symptoms.
Yeah, I bet.
From the classic stuffy nose
Uh-huh.
to facial pain,
Oh, yeah.
pressure headaches, even a cough,
Oh, really?
especially a nighttime cough.
Interesting.
And one thing to keep in mind is that there are different types of sinusitis.
Okay.
You have acute sinusitis, which usually clears up within a few weeks.
Right, right.
But then you have chronic sinusitis, which can drag on for months or even longer.
Oh, wow. That sounds miserable.
It can be.
So what causes sinusitis in the first place? I mean,
Well, the causes can be pretty varied.
Okay.
I mean, you've got infections, obviously, both viral and bacterial.
Yeah.
But it can also be triggered by allergies.
ah,
Even things like air pollution or nasal polyps can contribute to it.
wow. So many different factors at play.
Yeah.
Now, for us microbiologists, things get really interesting when we start talking about the infectious agents.
For sure.
And that's where our friend Aspergillus flavus comes in.
Exactly.
So what can you tell us about this fungus?
Well, Aspergillus flavus is a fascinating one.
Okay.
It's described in Microbiology as being both saprotrophic, meaning it can obtain nutrients from dead organic matter.
Ah, like a decomposer.
Exactly.
Okay.
But it's also pathogenic, which means it can cause disease in living organisms.
Oh, so it's got a bit of a double life going on there.
Yeah, it does.
Interesting.
And it's actually a major culprit in a type of fungal infection called aspergillosis,
Aspergillosis.
which can be particularly dangerous for people with weakened immune systems.
Right, so we're talking about immunocompromised individuals being especially vulnerable. Now, one thing that always strikes me about these microscopic organisms is how they can be so visually striking.
Oh, yeah, for sure.
And from what I've seen on Microbe Canvas Aspi, Aspergillus flavus is no exception.
Definitely not.
What does a colony of this fungus actually look like?
Well, it has this kind of powdery surface
Okay.
due to all the spores it produces.
Right.
When you first look at it, it's got this vibrant yellow-green color on top.
Oh, wow.
But then underneath, you'll see a layer of reddish gold.
Really?
Yeah, and it grows really rapidly,
Yeah.
giving it this fuzzy or downy texture.
It's amazing how something so small can have such distinct visual characteristics.
No, it's fascinating.
So we're dealing with this tiny fungus that can have a huge impact, especially when it finds its way into the sinuses.
Absolutely.
And it all boils down to how it grows, right?
Right.
Tell us about that.
So, Aspergillus flavus, like many fungi, grows by forming these thread-like structures called hyphae,
Hyphae.
which branch out and intertwine to create a network called mycelium.
The mycelium?
Yeah, and these hyphae secrete enzymes that break down complex nutrients,
Okay.
allowing the fungus to absorb them.
So essentially they're breaking down the surrounding environment to get what they need to grow.
Exactly.
And if that's happening in the sinuses, that can't be good.
No, not at all.
I mean, think about it. Those hyphaes are essentially breaking down tissue,
Yeah.
causing inflammation and damage.
Yeah.
And on top of that, they're also releasing conidiospores,
Right.
those asexual spores that can spread the infection even further.
It's like a chain reaction.
Yeah, microscopic one.
Yeah.
So for our medical microbiologist listeners out there, what are the key takeaways here?
Well, I think the main point is that Aspergillus flavus is a fungus that can cause serious complications in sinusitis patients,
Yeah,
especially those with weakened immune systems.
so it's something we really need to be aware of.
Absolutely. We have to know its characteristics and how it grows so we can diagnose and treat it effectively.
Now, before we wrap up, I'd like to leave everyone with a thought-provoking question.
Okay,
With antifungal resistance on the rise, how will this impact the way we approach fungal sinusitis in the future,
that's a good question.
especially cases involving Aspergillus flavus?
Yeah, it's definitely something to consider.
It's a challenge that we in the medical microbiology field need to be prepared for.
I agree.
Well, on that note, thank you everyone for joining us for another deep dive.
Thanks, everyone.
We'll see you next time.
See ya.